everyone, and welcome. If you're getting ready to ace your phlebotomy certification exam, you are in exactly the right place. One of the toughest skills you absolutely have to master is arterial blood gas collection, the ABG. So think of this explainer as your guide to really sharpening those skills so you can walk into your exam feeling confident. So what is the difference? I want you to just think about that for a second, because it's everything. In the real world, a valid result gets a doctor the critical information they need, like right now. A rejected sample? That means delays, redraws, and patient anxiety. It all comes down to getting the details right. And that's exactly what we're going to break down today. We're going to dive deep into the non-negotiable rules for patient safety, for keeping that specimen perfect, and for documentation. These aren't just for your exam. These are the habits that will make you a fantastic phlebotomist. Okay, let's jump right in, and we have to start with the most important rule in all of healthcare. First, do no harm. And with arterial punctures, that means we have to be on high alert for ischemia, which is a really serious complication.
So what exactly is ischemia? It's when blood flow gets dangerously restricted, and your examiners are going to expect you to spot these warning signs instantly. We're talking about pain that's way out of proportion for a simple needle stick, or you look down and see the patient's hand turning pale or even bluish. Those are massive red flags.
So if you suspect ischemia, you need to act fast. These are the exact steps you need to have memorized. First, get rid of anything that's constricting the arm immediately. Second, get that limb to about heart level to help with blood flow. Third, you can apply some gentle warmth. And finally, and this is the most critical step, you summon a clinician for an urgent review. Another major safety issue is nerve contact. You'll know it if it happens. The patient will tell you they feel an electric shock or a burning pain, maybe some numbness spreading down their arm. If you hear that, your immediate action is to stop. That's it. Just stop. Withdraw the needle along the exact same path it went in, apply some gentle pressure, and then make sure you document a full neurovascular check. Okay, so you've done a safe draw. Awesome. But that's only half the battle. Because if that sample gets compromised, all that careful work was for nothing. Handling errors are a huge reason for sample rejection, and you can bet your exam is going to focus on them. All right, listen up, because this is probably the most important point in this whole section. Air is the absolute mortal enemy of an ABG sample. I mean it. Even a teeny tiny little bubble can completely wreck your results. It makes the oxygen levels look artificially high and the carbon dioxide levels look low, which could lead a doctor to make the totally wrong treatment decision. So, how do we fight this enemy? We follow the anaerobic standard. Just think of it like this: expel, cap, and lock it down. The second that needle is out, you expel any air bubbles you see. Don't wait. Then you immediately lock on that special air exclusion cap. And once it's on, it stays on. Period. 15 minutes. I want you to burn that number into your brain. For a standard plastic ABG syringe sitting at room temperature, you have a 15-minute window to get it to the lab for analysis. It's like a ticking clock. Any longer than that, and the living cells in the blood start changing the gas levels, making the sample totally useless. This right here is a classic exam question, so pay close attention. When it comes to ABGs, there is only one acceptable anticoagulant, and that's heparin. And not just any heparin, it has to be the specific, dry, balanced heparin that comes in those pre-made ABG syringes. If you use anything else, EDTA, citrate, you name it, you've just invalidated the entire test. The second that cap is on, it's time to mix. But, and this is a big but, you have to be gentle. We're talking a delicate dance, not a rock concert. Gently roll the syringe between your hands or do a few slow, easy inversions. Whatever you do, do not shake it. Shaking causes hemolysis. It literally bursts the red blood cells, and that will mess up all your results. So you've done it. You performed a safe draw, you've protected the specimen, you're almost there. The final crucial piece of the puzzle is perfect documentation. This isn't just busy work. It's your professional proof that you did the job right. And yeah, it's definitely something you'll be tested on. Think of this table as your ultimate cheat sheet. Every single one of these fields is non-negotiable. You need 2 ways to identify the patient: the exact date and time and where you drew from, and the patient's FiO2, which is just the concentration of oxygen they're breathing. You also have to document your safety checks, like the result of the modified Allen test, how long you held pressure, and the patient's status after you were done.
Every little detail matters. All right, you're ready? Let's kick this into high gear with a rapid-fire review of the absolute highest yield points. These are the things that show up on certification exams over and over again and really separate the folks who know their stuff. Seriously, if you can just avoid these 4 things, you are way ahead of the game. A lab will automatically reject a sample if it has air bubbles, if it's clotted, if the label is wrong, or if it's too old. These are the absolute deal breakers. Get them right every single time.
Okay, here's a key distinction that can really trip people up on an exam. You have to know the difference between managing a hematoma and managing ischemia. A hematoma is basically a bruise. You handle it with pressure. Ischemia, though, is a true emergency that requires you to escalate to a clinician immediately. They are not the same thing. You want a real pro-level tip? Something the examiners love to throw in to see who's really been studying? Here it is. If your patient has a really high white blood cell count, that's called leukocytosis. Those cells are like little engines burning through oxygen like crazy. That means your 15-minute window just got way, way shorter. That sample needs to be analyzed ASAP. Now let's zoom out and look at the big picture. Your exam might throw you a scenario like, hey, this department has a really high rate of clotted ABG samples. What should you do? They want you to connect the dots and suggest a solution, like retraining the staff on proper mixing technique. It's all about showing you can think about quality assurance. So as we wrap this up, remember that all these rules and details, yeah, they're going to help you pass your exam. But it's so much more than that. This is about building the foundation of your professional career. The skills you're mastering right now are what will allow you to protect your patients and give them the absolute best care. Now go out there and get ready to be amazing.